So this is chapter 15, allergic reactions. There are many similarities to the asthma reaction, but there are distinct differences. So an allergy is a hypersensitivity to an ordinarily harmless substance. So the majority of allergies are environmental. And the most common would be dust, pollen, latex, foods, peanuts, tree nuts, shellfish, milk, eggs, wheat, insect stings, medications, aspirin, insects, penicillin, or radiographic contrast media. So this is where it can be the triggers can be likened to asthma. Some of these cross both. So in the dental office, once again, it could be latex, glutens, pine nuts. And pine nuts can be included in some fluoride varnishes. So always, when you're getting fluoride, always read the ingredients because this could set off an anaphylactic reaction or an allergic reaction in some of your patients. Sodium metabisulfite, which is a preservative and local anesthetic agents, can have an allergy to that, just like it could possibly set off an asthma attack, and ester type topical anesthetics. So reactions vary from mild symptoms, which are usually like skin rashes, to all the way to a life-threatening situation, and it can end up in cardiovascular collapse and more severe form. In fact, the most severe form is called anaphylaxis. So that's where your throat closes up completely. Everything just closes completely up, and you are minutes from death. So the more quickly the reaction occurs, the more life-threatening the symptoms. So sometimes if people are allergic to something, it may take them to go home and be hours later or the next day, they can start to get the allergic reaction. And so those usually are not as serious as the ones when they when they have a reaction like super quickly. The severity of the allergy is often dependent upon the amount of allergen, the rate of exposure, or the route of exposure. Death is more likely in older individuals and females from cardiovascular collapse and respiratory arrest. Severe allergic reactions cause approximately 1,500 deaths a year in the United States. And there are 4 types. And you don't really need to know type 2 and type 3, but I would pay attention to type 1 and type 4 because they have to do with more the dental issues. The type 1 allergic reaction would be someone that has an immediate response. And of course, if they have an immediate response, it's likely to be a little more severe. Type 4 is a delayed response. So they can have a delayed hypersensitivity of up to more than 12 hours sometimes. So those are the 2 types that if ever they're on boards or test questions, they're always talking about type 1 and type 4 as to what we may experience in the dental office. So the allergy is a physiological process. You have your initial exposure to an allergen. They call that initial exposure the sensitizing dose. I would know that. It elicits the production of antibodies to try to fight off the antigen. And one of the antibodies produced is called IgE. And so IgE attaches to mast cells and basophils, and it can lay dormant until the body encounters that antigen again. And when it does encounter that antigen again, it's going to be their second exposure. That's called the challenge dose. So you have the initial exposure and the second exposure, which is the challenge dose. Mast cells and basophils are found in your lungs and small intestines. So that's why your lungs are going to be the ones that are going to be affected. The antigen by now is referred to as an allergen, and the IgE, immunoglobulin E, is now recognizes the antigen. So the mast cells and basophils rupture, and when they rupture, they release the chemical mediators, and they're called histamines, which try to destroy the allergen. So the release of the chemical mediators cause the initiation of the allergic reaction. And so that's the actual process. And is also why when people they don't want these histamines, these chemical mediators, so they go to the drugstore and buy antihistamines to try to stop the release of the histamines in their system, causing that initial reaction. So the release of the histamine causes flushed skin tone, edema, upset stomach, urticaria, which are hives, reduced blood pressure, increased heart rate, rhinitis. It's a nasal, anything rhin, or R-H-I-N. It has to do with the nose. So it's inflammation of the nose and mucus. The classic signs and symptoms of an allergy, it's variable. It tends to develop very gradually. It begins with itching, pruritus of the gingiva. It can even kind of feel like the gingiva is itchy. Your throat, your palms, your feet. It's followed by a rash, which is urticaria or angioedema. So angio means anything to do with the blood vessels. Edema is a swelling, and it can be swelling with fluid or just swelling. So that's where the blood vessels can swell up. Bronchospasms, difficulty breathing, and wheezing. So hypotension can cause, it said before, a decrease in the blood pressure. You may have a rapid, weak pulse from the vasodilation. So if severe, it can lead to cardiovascular changes, which is usually a collapsed form. So tachycardia, arrhythmias, and when a person is experiencing that, very often that's when we'll get the EpiPen, because the epinephrine, which epi is short for epinephrine, pen, it's a vasoconstrictor. So since everything that's happened so far in the process is causing the blood vessels to dilate, causing the low blood pressure. And so when we put the EpiPen in the body and that epinephrine is able to get in there, it helps to close it back up. So this is angioedema, and usually when they talk about angioedema, they're talking about, it's usually painless, but it can be like the swelling of the eyes, all this puffiness around the eyes. It can be on your hands. This is one hand. This is how puffy it can get on the hands. On your lips it can get, or the face. And usually when you hear the word angioedema, you're going to think about this swelling of the eyes, hands, lips, or face. So urticaria, which are the hives from an allergic response, you can see how red it is up and down the arm, and it's not from a sunburn. This is from hives from an allergic response. So classic signs and symptoms of an allergy: patient who reacts to insect stings are more likely to have cardiovascular symptoms. Patients who react to food or an oral route are more likely to have the respiratory reactions. Then you can have what's called a biphasic reaction. This I would know for quizzes and tests. A biphasic, which is two phases, phasic phase and bi two. So it can have two phases of the reaction, or biphasic. Within 1 to 72 hours after successful treatment and that initial response has been resolved, you can have another reaction. So it usually occurs sometime within 3 to 10 hours, but it can be up to 72. It's more likely if the allergen was ingested, something that you ate, and the second episode may even be more severe though, this biphasic reaction. So treatment depends on the severity, and what you try to do is remove the causative agent, whatever it is causing the allergic reaction. The treatment of a mild allergic reaction: localized reaction like slight redness or itching in the area of inoculation, and it appears self-limiting. So mild is it's not going all the way up and down the arm like the picture of that one girl. It's just in a localized area. So first, you're going to remove the suspected allergen if that's possible. You want to administer an oral histamine blocker that you can buy at the drugstore. Chlorpheniramine, 10 milligrams, or oral diphenhydramine. So diphenhydramine is just another name for Benadryl. So oral Benadryl for 3 days. You would do either one. You're going to place the patient in a supine position and observe an hour for any worsening symptoms, unless they are having severe breathing problems, and then you'd sit them upright or semi-upright. So treatment of a severe allergic reaction. The symptoms worsen, and it can begin with severe symptoms of difficulty breathing, dyspnea, low blood pressure, hypotension, and laryngeal edema, which is your throat swelling up and closing up. So that's when that happens on the throat. That's the patient exhibiting anaphylaxis. And you need to call EMS, have someone call EMS right away. You're going to follow that with an epi injection, intramuscular, which is what IM means. After review of the medical histories to make sure the patient does not suffer from severe hypertension or ischemic heart disease. Epinephrine has a tendency to make the heart race just a little bit more. It increases the heart rate. So if your patient has severe hypertension or ischemic heart disease, you would not want to give them something that's going to even make it go faster. So a severe allergic reaction, you can administer epinephrine IM, intramuscular. So the emergency kits usually they can have a little syringe that already has the amount that you need in it, or they will have a syringe and needle and a little vial that will contain just 0.3 milliliters of a 1 in 1,000 solution. So they'll usually put this in the deltoid or the quadricep muscles over 10 seconds. You're going to massage the injection site for 10 seconds. What this does is it's going to reverse the really rapid vasodilation. It's going to reduce the edema and the swelling. It induces bronchodilation. So instead of all those bronchioles, those little circles in the lungs constricting tightly, they are going to dilate more, making it easier to breathe. It's going to have a positive effect on the heart and suppresses release of chemical mediators or histamines. So you're going to repeat the dosage after 5 minutes if there's no improvement, and they can have up to 3 doses. So it's usually termed 3 doses in 15 minutes, every 5 minutes apart. If they still need it, if they start to recover from that after 2 doses, then keep it at the 2 till EMS can get there. So epinephrine, but you may need to give an additional dose intramuscular, so you should have 2 available syringes or vials of epi, 1 in 1,000 with a syringe. Hopefully by then EMS has arrived and you won't have to worry about a possible third dosage. Most fatalities, however, occur when epinephrine was administered too late. They're nervous to, give a person the EpiPen, and most every emergency kit that you'll have at your private practices, and like we have here at the clinic, has an EpiPen. So you can't be afraid to use it. You're going to place the patient in a supine position with their legs elevated unless they have severe breathing problems, dyspnea. Then, of course, you're going to sit them upright or semi-upright. You're going to administer oxygen 4 to 6 liters a minute, possibly if they need it, and monitor their vital signs. So inhaled epi is ineffective. They have some epi that they tried to give as like an inhaler type to get that in the system, and found out that it doesn't work as well because the blood plasma levels are not high enough when you inhale. So treatment of a severe allergic reaction, after that, you're going to administer a intramuscular hydrocortisone. And so you're going to administer a histamine blocker, IM, or diphenhydramine, 50 milligrams. And then usually right after that, you would administer the hydrocortisone to kind of keep that action going. And you want to monitor the patient if this happens in your office chair for at least an hour. You want to see if they're going to have a second phase or a biphasic reaction. And so if they recover from this, sometimes they want to go ahead and finish their appointment if there's time. And if not, and it's okay to do that if they're okay. But usually what we'll do is refer them to an emergency department. And that would be pretty much it on the severe allergic reaction. Once again, I want you to visit the repair page a few pages after the end of the chapter.